Hello, my name is Kim Skeen. I'm a registered nurse working for the Taking Texas Tobacco-Free Research Program. We're an academic collaborative partnering with the University of Houston and funded by the Cancer Prevention and Research Institute of Texas. Thanks for joining this webisode to discuss tobacco use and COVID-19. Tobacco impacts every organ in the body, and using tobacco leads to a lot of negative health outcomes, especially when it comes to lung and heart health. Here are just a few examples. Smoking cigarettes is the #1 cause of the lung disease called chronic obstructive pulmonary disease. You may hear this simply referred to as COPD. Smoking is also a major cause of heart disease. In fact, 25% of heart disease cases are directly attributable to smoking. Finally, people who smoke cigarettes are 30 to 40% more likely to develop type 2 diabetes. And the more cigarettes a person smokes, the higher their risk for developing type 2 diabetes. This is important to know because people with lung and heart disease, as well as diabetes, are also at higher risk for developing more serious complications from COVID-19 illness. SARS-CoV-2, the virus that causes COVID-19 illness, also negatively impacts the lungs and heart. The virus enters your lungs and begins replicating itself. Once this happens, your lungs begin to swell and fight back against the illness. This can lead your lungs to scar, stiffen, and possibly even fill with fluid. This lung damage prevents oxygen from reaching the heart, which then damages heart tissue directly. And it makes it harder to get oxygen to other tissues throughout your body. This is why smokers who get COVID-19 may experience poor health outcomes. Smoking is a risk factor for negative progression of COVID-19. This means that for smokers who contract COVID-19, they can experience more severe symptoms that could require hospitalization and are more likely to result in death. Some groups that experience higher than average rates of tobacco use include racial and ethnic minorities, as well as people with lower education levels and lower socioeconomic status. Low socioeconomic status refers to adults who have a lower level of education, who are unemployed, or who live at or below the federal poverty level. In the United States, people living in this low socioeconomic status are more likely to smoke than the general population. Cigarette smokers with lower incomes are also more likely to suffer from diseases caused by smoking compared to smokers with higher incomes. This includes having higher rates of lung cancer. Reasons for this disparity include less access to healthcare, which makes it more likely that they are diagnosed at a later stage of disease. This lack of healthcare access also affects people in this group who may require emergency treatment or hospitalization for COVID-19 illness. We also see that secondhand smoke exposure is higher among people living below the poverty line and is also higher among people with less education. As COVID-19 continues to evolve, it's important to keep these disparities in mind. All of these groups have been targeted by the tobacco industry using aggressive marketing strategies. It's important for everyone to know that the tobacco industry has a long history of targeted marketing and understand how they or their communities may be affected. Knowledge is power, and sharing this knowledge with others is equally important. The bottom line is that we know tobacco, smoking, and COVID-19 illness can cause damage to the heart and lungs. Additionally, smoking damages cells, weakens our immune system, and makes it more difficult to recover from illness. These compounding health risks have shown just how vulnerable our bodies can be and how this combination of health factors can lead to higher death and disability rates for smokers who get COVID-19. The best thing you can do to protect yourself and your loved ones is to quit using tobacco. This is especially important since there are a lot of COVID-19 cases, both in Texas and throughout the United States. Now is a great time to quit using tobacco, and there are many resources available. Begin your quit journey today and check out our current project at www.takingtexastobaccofree.com, where you can access short educational videos, quit resources, and learn more about our current project. We also have free implementation resources and real-life examples of tobacco-free workplace policies and outcomes. If you work in or are a patient of a healthcare center that doesn't currently have a tobacco-free policy, please contact us to see how we can help. There are other resources to help you quit using tobacco. The Texas Department of State Health Services provides the Texas Quit Line and has both online and phone counseling programs. No referral is required, and you can access free confidential counseling 24/7. For qualifying callers, 2 weeks of free nicotine replacement therapy is also offered. You can call 1-800-QUIT-NOW. The COVID-19 pandemic has led to much uncertainty, but you can take control of your health and improve your chances of a full recovery in case you contract COVID-19. Start your quit journey today. Thank you so much for joining this webisode, and thank you to the Health RCMI for letting us join today. Stay tuned for more webisodes.